For the inauguration ceremony, I call upon the dignitaries on the stage. Padma Shri Dr. K.S. Gopinath sir. Secretary IASO Dr. Rudra Prasad Acharya. VP and Business Head, Fortis Hospitals, Bangalore, Mr. Akshay Oleti. Chancellor, Enepoya University, Mangalore, Dr. Vijay Kumar sir. President-elect IASO, Director, HOD Surgical Oncology of Indo-American, Subramanyeshwara sir. Senior Director, Surgical Oncology, Fortis Hospitals and the Organizing Chairman, Dr. Sandeep Nayak. Consultant Surgical Oncology and the Organizing Secretary, Dr. Bharat Ji. Consultant Surgical Oncology and the Organizing Secretary, Dr. V. Shrikant Reddy. Now we'll start with the welcome speech. I call upon the Organizing Chairman, Dr. Sandeep Nayak sir, to have few words.
Good afternoon, everyone. It's an absolute honor for me to welcome you all to COLOCON 2025. When we started thinking about the, what to really do for a conference, because we were thinking that, some educational event should be done, we had a thought that, colon cancer is one of the most common cancers today in the list. It's rising up the list. It's, if you look at the world data, almost 1 in 20 individuals living today will suffer from colon cancer. That's why from morning we were discussing about early detection to early treatment, and in the next half we'll be talking about advanced diseases as well. So our intention of this conference is to educate young surgeons about how to handle a colonic cancer. So MIS, minimally invasive surgery is emerging as a major part of colonic cancer. It is established as a good way to do, or handle colonic surgery. And in this, we have focused on that. In fact, we have to, I have to also emphasize that, many of the major, people who have established this field in India are sitting here on the dais as well as in the audience. They are all, agreed with us to come here and participate and give you the knowledge. So I have to take, it's my proud privilege to welcome them all to this particular program. It is also, the interest that all of you have shown. In fact, more than nearly 200 people are sitting here in the audience today, and that is the interest that all of you have shown in this particular program to learn, to interact, is what makes this success. So I welcome you all. So there are many other, cogs and wheels of this particular program, which has so far made it successful, and I am standing here today to welcome you, every one of you who have made this program successful so far and will make it successful in the next half of the day. So we will also be, having a gala dinner at the end of the day to really interact, but interaction should happen here. I would really be happy to see you all interact with each other and learn and express your thoughts in the open. So, to end my talk, in fact, it is my proud privilege to have the associations with us today. That is, the Samrohana as well as the IASO, Bangalore Oncology Group, and Fortis Hospital, who have participated here and has supported and made this program successful. So, my heartfelt gratitude for all these groups, and I hope this becomes an excellent forum for you to interact and make it success. Thank you.
Now we'll have the lighting session. Dr. K.S. Gopinath sir to speak a few words.
Good afternoon, ladies and gentlemen. I don't want to come on the way between lunch plate and all of you. And I have to really thank Sandeep Nayak and his team for organizing this meeting. And it is going to be a very useful meeting since morning what we are. As Sandeep Nayak has mentioned, if you look back to the ICMR registry of Bangalore, 1982 to 89, we were not mentioning the incidence of colon cancer. Now over the years, there are a lot of change which has taken place. Now it is mentioned it in the cancer registry. 10 years younger than the other part of the world, we developed the rectum and colon cancer. Rectum is more common than the colon itself. You all know about it, the data available through the ICMR. The most important thing is the continuing medical education which is needed for all the professionals is a very important aspect of it. As we were all discussing, the surgeon is an important prognostic factor. In order to give a good results and change the prognosis, this kind of a meeting. A CME should not mean that it's cocktail meet entertainment. It should be a useful interaction between the professionals participating, because more than 50 to 60% of the audience here are all the faculties in various institutions. Make this opportunity and use it. And another small appeal to the president and secretaries. Whenever you are presenting the data, we have Indian Journal of Surgical Oncology. Lot of articles are presented, multi-organ resections. You should have mentioned it few. You are the future president. And peritoneal surface malignancies, you have published volumes and volumes. Take the journal forward and see that those articles are mentioned in your presentation. So people will come forward to present their own data and you can create. And through your association, you can impress the insurance companies. They should give the sanctioning for the robotic and minimally invasive procedure. That will be the right way of looking at it, and use the documentation from these meetings. Thank you very much. Thanks for the invitation.
Thank you, sir. Now I call upon Mr. Akshay Valeti to speak few words.
A very good afternoon to one and all. I'll just take a couple of minutes. I'm the only non-medico on the stage and mostly in the entire crowd as well. So maybe my thoughts would not be very much in sync with how the other doctors would think. But at the outset, I would like to congratulate COLOCON-2025 for being such a big success. Thanks to the vision and guidance of Dr. Sandeep Nayak and the entire organizing team, I think we have an excellent crowd and great learnings all around. Thank you to all the dignitaries also who have come from far and beyond. One thing we notice as administrators in the hospital is that typically a hospital's patient mix would have 40-45% of insurance patients. But in oncology, we see that insurance number is around 20% only. So when I ask my team, where are the insurance patients? Why aren't they coming for oncology treatment? My team comes back and says, no, they're all insurance patients, but their insurance does not support or their limits are exhausted. So cancer treatment is something that is becoming more and more expensive by the day. Newer drugs are coming in, newer ways of treatment are coming in. Obviously, there is a lot of development on the clinical front, but the cost is also going higher and higher. So my request to all of you as doctors as well, and obviously for all the administrators, if there are any in the room, is let us keep the cost to the minimum possible. Let us try to help as many patients as possible, because the more affordable the treatment is, the better it is for everyone in the world. And let us try to create that difference also in the society. With that note, I'd like to thank once again everyone who has come in and make this program a big success. Thank you.
Thank you, sir. Now we'll have the vote of thanks by Dr. Bharatji.
So a heartfelt thanks to all the dignitaries on the stage, Samravana Cancer Foundation, Fortis Cancer Institute, IASO and BOG for being associated with the event, all the faculty and delegates without whom the event would not have been possible. I would like to thank my sponsors, Johnson & Johnson, Curotherm, Stryker, Bard, Regency Life Sciences, 4Base Care, Applied Medicals, AstraZeneca, Intas, Agilis Diagnostics and Intuitive. And last but not the least, also thank the audiovisual team Skyline and the Hotel Management Green Park for the wonderful event. And lastly, the organizing team for doing a great job. Thank you very much.